Thanks everyone for joining us for today's webinar looking at brain health. I'm Andrea Salmon. I'm your facilitator today, and it is my pleasure to have Jodi Haartsen online with us today as well. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present and emerging, on whose lands we meet wherever we're coming in from today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. Jodi Haartsen is our presenter today, and Jodi is now our Executive Manager at MS of Client Engagement and Wellbeing. Having started during COVID, the poor thing, we're all working remotely. Jodi started her MS health career over 20 years ago as part of a nursing career in general neurology, neurosurgery, nursing education and research. And Jodi's roles have included MS nurse practitioner and the manager of the MS clinic at Eastern Health, MS researcher and MS educator. She's a member of the Global MS Brain Health Steering Committee, and she's passionate about the MS Brain Health Initiative. Jodi's also studied a Master of Nursing and Naturopathy. So it is our pleasure to welcome you, Jodi, and I'm going to flick a couple of buttons and pass over to you to be the presenter.
I think that makes me on track. I was just listening to Andrea talk. Yeah, good to go? Okay. I was just, hello everybody, thank you so much for having me today. I was just listening to Andrea say that we don't use chat in the webinar, and I thought, I really wish that I could chat to all these people, and I really wish that I was there with you all to be able to. But isn't it wonderful that we do have technology now that can bring us together in this way? And thank you, Andrea and team, for inviting me to talk about something that I am very passionate about. When we talk about brain health, it means lots of things to lots of people, and none of them are right or wrong. But what I'm going to talk to you today about is what is the MS Brain Health Global Initiative, and what that means. I'll share with you a little bit of my journey in participating in this initiative, and also a little bit about how it started, and most importantly what I think it can do for people with MS globally and around the world, and also hopefully for you as well too. So being part of the MS Brain Health Initiative personally it's really been a gift for me. I spent many years in MS nursing, really frustrated by what I could see, that, you know, there were people who were, as an MS nurse for 20 years in the MS clinic, I could see that there were people who were really fortunate to have had great access to services and great treatment early, and a great team to look after all their needs, and were really well supported, and what that meant for people in terms of outcomes really mattered. And the difference in stories that I heard just within 2 suburbs away, the people's experience in terms of what I commonly call as surplus suffering, and that some people's journeys were filled with difficult access and people not hearing them and not being heard, and having long delays to access to services and treatments, and those outcomes were really different, and it really frustrated me. And then I guess part of being part of this global MS Brain Health Initiative was really gave me a light to be able to say, hey, I can really start to do something about this. And so that was sort of where it started, where being part of the Global Brain Health Initiative started for me personally. And I think that it really captured and helped with understanding that MS is the focus in so much was about preventing disease, and when we talk about brain health, it starts to really shift from thinking about disease prevention to also thinking about keeping brains healthy and keeping brain and spines. I'll refer to brain a lot, but I mean brain and spine. Brain and spine's helpful, and that if we could really shift our messaging around that, then we can really have better outcomes for people with MS, and that's sort of what I feel most passionately about, and why I have been in MS care for such a long time. So I felt really frustrated about inequitability in access to services and access to care, because I felt that they all aspects of care and support, because I really felt that I could see the differences from, as I said, from one place to another, and that was within my own country, within my own state in Victoria, but also globally there was huge discrepancies, and I was very fortunate enough to be involved in some global MS nursing activities, and that gave me a little bit of an understanding of how this of the issues that were around, the differences around the world. So that gets me started. That's sort of the background as to how I got involved in the MS Brain Health Initiative. But I'll talk to you a little bit about about how others got involved in the MS Brain Health Initiative and how that started. The MS Brain Health Initiative started really from the UK. Some of you may be familiar with Gavin Giovannoni. He's a pretty famous MS neurologist now. So he was working in the UK, and he felt the same pain as what I did, and frustrations about how, you know, really time matters in MS, and that we really need to act with urgency. And urgency in the UK has a fairly different definition of urgency in the in Australia in MS, but they had lots of long delays, and really he was hearing stories every day about people just not getting access to the complete package of support that they needed, and that meant that people's outcomes were certainly not as good as those who had all those services available to them. And the research just kept building on this concept that that we needed to do things quickly to be able to keep people's brains healthy in MS. And that's not just starting treatments, but there's lots of different things about how we can work towards keeping people's brains healthy. And as I said, just shifting from a concept of disease prevention to keeping people healthy. So that he found that there was like-minded neurologists who felt the same way, and so they joined together. One of them was Helmut Bootschuven from Australia, and they joined together initially to start a group who engaged a Oxford Pharmagenesis, which is a policy group, to really start to sort of take core concepts of time matters and really make them practical and livable, and really create policy around that. And if we think about what we live in now in COVID, and how policy can really make a difference to people's behaviours, and to really start to change the way that we do things. It's just one part of it, but it's a really important part, and something that I feel really privileged to be a part of. So when we look at more about the concept of time matters, what we've really started to understand in MS, or what the science is telling us, is that even though we can see relapses in MS and we can see disability down the track, what we've really understood now is that damage accumulates over time in MS, in more people than people without MS, and that there's a certain amount. It's not just relapses that contribute to ongoing cumulative damage and disability in MS, but relapses are just part of the picture, and that there's a lot going on underneath that. And one way of looking at that is looking at what's called the neurological reserve. And the neurological reserve is the capacity of the brain to adapt and be resilient in terms of damage occurring. But that sort of starts to lessen over time as more damage occurs and disability accumulates. And the science and the research was really pointing to this understanding more and more. As we got better advanced MRI technology, we could really see in the research studies that this was happening earlier and earlier, which furthered the message that we needed, that time really mattered, and that we needed to get onto this early and do something quickly and respond quickly, and so to prevent damage and to keep brains healthy. So what that group of people did was want to bring that science and bring what we could see happening, and what the recommendations were, and how can we actually bring that to life, so that we get really broad population health outcomes, so that we are able to sort of get the message out across more broadly than what we were just in the own little science bubble, I guess, I suppose, and the research bubble that didn't sort of give people access and also really drive change. So as I said, what they did was come together and develop what was called the MS Brain Health Initiative. And that was originally started with a large group of people. George Pepper is a person with MS. He was one of the key people in this group as well too. He has an organisation called Shift MS, which is a fantastic organisation based in the UK that really supports MS care for people as well too, and has a really active voice in a lot of what goes on in the UK as well too. And then Helmet, as I mentioned, and people from across different parts of the world. It included people with MS. There was a health population specialist as well, and an economics specialist who were involved too. So it wasn't just neurologists. And then of course there was one or two MS nurses. Originally, I wasn't in there in the group, but I'm excited to say that I now have had the opportunity to join that. And what this group of people did was join to write a guide and a policy for how we can help promote people's brain health. And they made lots of recommendations as part of that initiative. And one of the recommendations is focused on a policy document for organisations such as MS Australia or MSL and neurologists about the recommendations for how we promote healthy brains in people with MS and the importance of acting early. And they also wrote guides for GPs, and they also wrote guides for people with MS. And so what I'm going to talk to you a little bit about today was what's in that guide for people with MS. They also wrote a guide for nurses as well too, and so really to help all people involved in MS care really capture the essence of what we were talking about when we talked about that time really does matter in MS to keep people's brains and spines healthy. So part of the development of this guide was really looking at what are the key recommendations for people with MS. And the key recommendations that came out of this policy document was to understand the importance of brain health, that early diagnosis and early referral really matter. And as I said to you before, I heard so many stories of people, and I'm sure that there are many stories that you've probably heard or have yourself of how difficult it can be in accessing that initial diagnosis and getting the GP. Some people, it was 9 or 10 years of telling people their story and not being heard and not being able to get a diagnosis. And so understanding that that's really important and giving out that message to people with GPs was really is really something that's high on their priority list as part of this initiative. Early treatment with the appropriate and DMT is disease modifying therapy. The early treatment, they have found more and more research that suggests and recommends quite strongly that the earlier you start treatment, the better the outcomes are in the long term. And there's lots of big global research initiatives that are capturing lots of data that are monitoring people over time, and evidence keeps building about the importance of choosing the right treatment at the right time for better outcomes. And the other really important thing was living a brain healthy lifestyle. And we've really started to understand and focus in MS care, and I mean, I think lots of people with MS were already onto this one, but really to make that a part of everyday clinical practice, because that's just as important in making sure that brains are kept healthy by choosing good alternatives and choosing lifestyles, and that we really needed to embed that every day as part of clinical practice as well too, and understand the importance of that. The other recommendation was the importance of monitoring disease activity and changing treatments or changing what you're doing in response to disease activity. And also the importance of making informed shared decision making. And these were really global recommendations, and therefore everybody all over the world to sort of, once you put that in the picture, that some people with, for instance, if you're diagnosed with MS in the UK, about 10 years ago, only about 20% of people were actually on a treatment, even up to 6 or 7 years ago. So, and in some parts of the world, people were just are diagnosed without any monitoring or without any follow-up as well too. So these are really tried to capture the key ways that we can recommend that people, it's not about recommending which treatment is the right one, it's about saying these are the things that we can do to help people keep their brains healthy. So I'm just going to go through each one of those. Early referral and diagnosis. This is something that many of you here today probably will have had a diagnosis with MS, but in terms of what the Brain Health Initiative is about, it's about also getting the message to GPs, getting the message around that if you have symptoms that look like MS, then it's really important to get to see a neurologist. Now, part of this initiative was people who all worked in MS clinics, so felt quite strongly about the value of having MS clinics and a special interest in MS clinics. Again, looking at outcomes, there was value shown in having a whole team approach. That's not accessible for everybody, but it was one of the things that came out as a recommendation that could be something worth trying to access specialist people, neurologists with a special interest in MS. They also, in terms of early access to diagnostics, such as an MRI, that's something that I really saw change in my last 5 years of working in an MS clinic, that people really had better access to MRI. I still heard stories of real challenges that people had to access MRI, but it was getting better and better all the time, and there was more recognition of people being able to get into getting even GPs to organise MRIs for them as well too. There was some tricky ways around that, but I think that there was just more and more evidence that an early MRIs was worth it. And then also, I guess in terms of getting a diagnosis, there were some people who don't get diagnosed straight away, but the importance of making sure that people have ongoing follow-up and repeat tests if there's a concern that it might be leading toward MS. The other part of the recommendation was early treatment, and this is just, as I said, the evidence seems, this is an article from 2015 that just really looked at the outcomes of people who started a treatment early, and that over time, you can see on that graph here that that early intervention really did delay onset of disease progression, and that was really something that that particularly in countries where there was little or no access to treatments at all, this was something that that was really a message that was part of it. As I said, understanding and deciding which one's the best one at the right time is a challenge in itself. But the overall concept of delaying treatment was resulting in worse outcomes was something that we're learning more and more about all the time in MS. And the more data, the more people that are involved in data collection and research studies that are tracking people over time, we're really starting to get some really good data out of what happens in 10 years if you do A, or what happens in 10 years if you do B. And for instance, in Australia, they have a big research database called MS Base, and that's been going for about 15 years now, and they've got, you know, thousands of people involved in that through the MS clinics, and they're really finding out some good information about what happens to people over time from a research perspective as opposed to the individual perspective. In terms of choosing a treatment, I won't talk too much about this because it is not really the focus of the Brain Health Initiative. Access to treatment is, but working out which one is the right and wrong one for you is something that that is going to have a whole lot of different factors involved, and working out risks and benefits is very much a personal decision. And this is one that I sort of like to use a lot. Coke was way onto personalisation before we were in MS, but it's certainly about getting the right one for the right person at the right time, considering so many of the different factors that matter. And so that sort of really, that personalisation is really important and is becoming more and more important as we see a whole lot of new therapies emerging in MS, and we start to understand which one's going to be right for the right person. There's so much more to learn about that, and it's an exciting area to be a part of, because I think we just keep getting better. That just keeps getting better in MS. But mainly now I'd like to talk a little bit more about the importance of leading a brain healthy lifestyle. And in my 20 years of MS, I really found it incredibly an incredibly important discussion to have with people about what were and what weren't the right things to do, and what was useful and not useful. There's so much more research now ongoing about living a healthy lifestyle, which is the right exercise to do, which is the right diet to choose, the importance of stress, and the importance of, I found that managing stress and community connections were really important, because if you're incredibly stressed, we all know how hard, especially Victorians at the moment, know how hard it is to live a healthy lifestyle when you're anxious and stressed and fearful, and managing those can be just as important. So as part of COVID, my kids have spent too much time, I have to say. I've got 2 young boys and they've both been spending a little bit too much time on Fortnite, so this is a bit of a Fortnite reference, but it's something that I see in the game Fortnite, which is a computer game. You can give yourself these things called chug jugs, and chug jugs are basically fortifying yourself, and they're giving you strength, and they build up your strength to be able to get the most of this the most powers in this game, and chug jugs. And you can also have this little case where you get all these magic things out of that give you strength. It would be lovely if it was that easy. But yeah, I sort of think of a brain healthy lifestyle as giving yourself a massive chug jug, that it really fortifies you, and really does protect your brain and keep it healthy. And it's just as important as keeping our heart healthy and our kidneys healthy, and keeping your brain healthy through a brain healthy lifestyle can really give you so much benefit. And so it's a really important part of the recommendations of the Brain Health Initiative, is to be able to adopt a brain healthy lifestyle. Now, I think, as I said earlier, there's really a lot of challenges about which is the right way to do that, and which is going to give you the best outcomes, and which is going to be the way to do it. And I would often, when in the MS clinic, when I was talking to people, I often really personalised this too, about what was going to work for you, and what was going to work for your family, and what was going to work for how you saw it. And some people walking, up and down their driveway was amazing that they could do that, and that was such a win, and it was such an achievement. And so I guess when you talk about change, which most of us need to lead a brain healthy lifestyle, we need to do change. And change can sort of happen in an epiphany moment where you wake up one morning and say, today I'm going to give up smoking, and you never smoke again, and it's great. But change also for most of us sort of happens in incremental wins and little changes on the way. Is another way that we can sort of approach this, and often the way that I would approach this with people in clinic too, to sort of look and say, hey, what can we do that's going to be achievable for you? And if it's an epiphany, and if you can turn it around and and do all those things in one day, that is awesome. There's no right way, or there's no wrong way. That really, in any ways are beneficial. There were some recommendations that we would discuss in clinic that were quite extreme, and I was fortunate to be able to have a background in naturopathy, so that sort of helped in some of those discussions. And some of them, I guess, they did have health consequences that were really important to discuss and consider. Other sort of the more extreme choices were also challenging on family function, and one thing I learned was MS is a disease that impacts on all the family, and keeping a brain healthy lifestyle is something that sort of that it's easier if all the family are on board, but it's also hard, and it can have a real impact on that too. So I think it's really important to think about that as a consideration as well too. And so these were some of the things, when you're thinking about leading a brain healthy lifestyle, that I sort of were things that were parts of the recommendation. They don't really talk in the Brain Health Initiative. They don't talk much about the recommendation of sleep, but I think it's something that in clinical practice, when we're talking about leading a brain healthy lifestyle, all of these things work together. It's all one part of the the big picture. But in terms of giving up smoking, there's a lot of evidence to suggest that that smokers do have worse outcomes in MS. A very challenging thing to do, but you're not alone, and trying to do any of these things alone is really is certainly something that's difficult, and there are lots of resources out there to support people. Doing exercise was also the difficulty of the paradox of exercise and fatigue in MS is a paradox that challenges all, and certainly something that there's been a lot of research and work on, and as I said, individualised plans can be something that's really benefit there. A diet, controlling your weight, there is more and more evidence to suggest as well too that people who suffer obesity do have worse outcomes in MS. So looking at diet and weight is an important part of management if it's a big problem. Stress and mood just impact on all of these things, and as I said, we know it more now than what we've all experienced in the last 6 months with COVID. How much that it's really hard to be able to do any of these things when your mood is low and or your anxiety is high, and making any of those changes can be really difficult. So I think it's just as important part of leading a brain healthy lifestyle is to look after your mental health, and that's a really important part of it too. And also sleep. As I said, doing any of these sorts of things when you're tired and understanding sleep. There's some great webinars I know from on MSL's little library there on sleep and how to get the most of sleep, and the absolute importance that it has in living everyday life. And also one of the things was working on keeping your cognition healthy, and sort of doing regular activities to keep your mind active as much as you can. There's still a lot of evidence emerging about that too, a lot of research being done about how and what is the best way to keep your mind active, and so I think it's a bit of a watch that space in terms of what's going to be the best ways to do that. I know that neurologists do love their little mind games on the computer. I was never one of a fan of those. I prefer to do crosswords, but I know that they liked to do their phone apps on them. They were the only people who stuck to them, I think. The other recommendation was monitoring disease activity, and that's about sharing your picture, the full picture of your health with your team to be monitoring. In the way that we monitor MS in clinics, we do regular MRIs, and many of you would have regular neurological examinations as well too. But I think capturing this monitoring is really hard. It's really challenging for people who work in the clinic setting, but it's also really challenging for people with MS, especially initially. I mean, how do you know? So many times I would talk to people, but how do you know what's a bad day and what's a new problem or what's a worsening problem? And this magic definition of a relapse, I really wish they could come up with a blood test that was a relapse, and hopefully one day they will. So many people were challenged about how to sort of understand what's the difference between something going wrong or bad day, and then how do you sort of write all this down, or how do you sort of in the middle of that clinic, you've got 15 minutes and it might be a busy clinic, and how do you sort of talk about all of this in one clinic session, and so I think that we've got a lot of work to do in the space of monitoring disease activity and how people can really share that full picture of their health with their team. It's an easy thing to say, but a very difficult thing to do. One thing that's really coming more and more into play at the moment is apps, and there's a lot of emphasis on people looking at new ways of capturing how we can monitor disease activity through apps. And I think in the next couple of years, we're going to see lots of developers develop little different tools that people can use, different tests that like the hand function and walking speed and lots of things that they do in clinic that can be converted into an app, little cognition tests that can be done quickly online, so that people are much more able to monitor disease themselves through regular use of apps. And it's something in other areas of health, in cardiac health and other areas, that certainly has become a huge focus. Diabetes is one particular area where they've already developed a lot of apps to really enable people to monitor their own health. And certainly, you know, I do love my Apple Watch telling me how many steps I haven't done most days. But it's certainly, these are all ways that I think will really be great tools in the future for people for MS to use, to be able to monitor their health and monitor some simple function as well too, particularly cognitive function as well too. So I don't think that's too far away. In the interim, I would suggest to everyone, as challenging as that can be, to keep a notebook, to be able to sort of have it, to be able to really capture some of the things that you're experiencing. I know that in my years of MS nursing, the people who sort of captured it down, either some people took a photo of something just to remind themselves as a prompt to say, oh yeah, that's right, that's how I felt that day. Visually, it's great to have prompts, and we would share them on the phone. Other people took notes, but it was so good when someone came into a clinic and said, you know what, I've just jotted a few things down that I wanted to talk to you about. It was really empowering and really helped them get the most out of their clinic. So I realise it's a challenging thing to do, but it's something that I certainly would encourage people to do in the absence of not having the fancy apps yet, which will be able to, but very close, as I said, very close, I think. And then hopefully in the future, there'll be blood tests, and there'll be better ways of being able to get a much better picture of what's happening in MS disease activity, and then be able to respond to that, because monitoring is the key to maximising lifelong brain health, and that's something that is really important as well too, because I think we've learned over the years that in MS, there is, you know, if we look at the picture of an iceberg, and we often know that underneath the waterline, there's a lot of things that are happening, and that there's a lot of damage that's occurring. And so that monitoring what's happening is a really important part of being able to change treatments or change what you're doing to be able to respond to that monitoring. And the more treatments that we have, the more ability we'll have to change a treatment that's also going to work in relation to lifestyle and what the person's needs are at the time. So as I said, it's a very complicated decision, working out which is going to be the right way to go, and which way, when is the right time to switch treatments, and when is the right time to take action. But the way that we measure things now, and as I said, in the MS clinic, you'll often have a neurological examination, which can sometimes pick up things that you even weren't quite aware of. And then regular MRIs are also helping, and the better the MRI gets, the better opportunity we have to be able to monitor as well too. We know that MRI techniques are getting better and better in terms of what they can measure and what they're able to sort of detect in terms of not just new lesions, but also if there's any volume loss, which is something that the brain has a certain amount of volume, and after 30, unfortunately, all of our brains are shrinking just a little bit every single day. But in MS, in some people, that happens. That can happen faster than people without MS. So we know that monitoring that is really important, and now we're getting better and better MRI techniques to be able to monitor that as well too. And so that's something that's an exciting part of the future. I was reading that some people in MS clinics can have their MRI done in 10 minutes, which I thought was fabulous. And I also saw a portable MRI machine, and it made me really excited, because I thought, oh, this is it wasn't a great MRI machine, but this is where the future can take us, and this will give people with MS so much opportunity to have access to these things that are really tell us a lot more about what's happening. Monitoring relapses is another really important part of maximising brain health as well too. And in my role at MSL, I'm still hearing stories, or I'm starting to hear stories of people, because of COVID, not having access to the usual care, having a relapse and saying, oh well, it was too hard to get in to see anybody. It was too hard to have an MRI. I didn't want to go out because I was worried. And I think it just reflects that now more than ever, we need to be really mindful of the importance of I guess, speaking for yourself and really saying, I really do need to be seen. And sometimes we have to push our healthcare services to work for us, as hard as that can be. but it is really important time to sort of still continue to monitor and still continue to make sure that we still are able to access services, and we as a responsibility in people who support people with MS really need to try and think of as many ways as we possibly can to facilitate that and enable that, and to make sure that's still happening. And I'm sure that perhaps at this end of this webinar, there'll be opportunities to share stories of how that's, if you've got any questions about how that can happen, or if there's any ways to do that, then please let me know. But it is something that I'm seeing more and more happening. I'm hearing more stories of people who are struggling to have access to what the services that they usually had at the time of diagnosis and throughout the diseases, throughout sort of their journey on the disease as well too. So. And we talked a little bit about brain loss and brain tissue loss and how important that is to be able to monitor for that as well too. Again, looking at the different ways that we can monitor disease, and in terms of what the developments that are going on in the MS space with better MRI techniques, and taking the time to do the proper clinical examinations and measure strength and tests. I always, once I learned how to do this as a nurse practitioner, I always was fascinated to see how one of the remarkable things about people with MS that I found is, or so many, resilience and courage. But one of the other things is that you just adapt, just adapted to a little thing, and you go, oh yeah, actually, you know, that leg hasn't been great for the last few months, but I didn't, you know, I just sort of got used to it and adapted to it, and so I guess at that point of examination was a really good opportunity to be able to talk to people and prompt people to say, hey, you're a little bit weaker on that leg. Did you were aware of that, or has that been something that's bothering you? And they'll say, oh yeah, actually it has been, and that would initiate an MRI. And so that examination is important as well too. And as I said, the people's adaptability was certainly in COVID. I keep reflecting myself saying, wow, I'm sure that people with MS are probably handling this better than I am, because they've learned to be so adaptive in their lives as it was. And then, as mentioned, the apps that are coming out will be something that's really helpful in the future to be able to get a better understanding of how we can really maximise lifelong brain health in people with MS. Because the end game is really about preventing MS altogether, but also about keeping people's brains as healthy as they possibly can. The next part of the recommendations in the MS Brain Health Initiative was informed shared decision making, and that is something that has been demonstrated again and again in the research, that if decision making, and it's not the focus in medicine happens to be, you know, always a lot around decision making in disease modifying therapies, but I think shared decision making about every aspect of your MS care is essential. At every aspect of how you're going to choose to make a lifestyle decision about your MS care, and if that's shared with your team and everybody's on board, and your team is neurologists, and your team is your physio, and your team is, very importantly, your family and friends. They're all team Catherine or team Sarah. They're all part of your team, and if everyone's on board in making a shared decision about what's important to you in every aspect of your care, then you really are likely to have much better support and much better outcomes as well too, and really develop better trusting relationships with that. And that's something that is a challenge to every person who provides support with people living with MS, to be able to really understand that it's not just necessarily the disease modifying therapies, that's an important part, but also all the other decisions that you're going to make, that they're part of they're a shared decision, informed shared decision making as well too, and that information is made available about which is going to be the best choices for instance, diet and exercise, which ones are emerging as the best options to choose, and also which one suits your lifestyle, which one suits your values, and also which one recognises your own limitations as well too. And so the more we can focus on that being being a part of every day of all the things that we do to support people with MS, I think the better off it'll be. And that's really captured as part of a key global initiative. These are all the things that are put together in this report that that is sort of aimed at creating policy and drivers for people to be able to say, you know, these are the things that can make a difference. It's like when you're thinking about preventing COVID, washing your hands, doing masks, they're the things that make a difference. They're the things that we can do, and that we could, if we can all work together, that they can make a really big difference to the outcomes in people with MS. So thinking about wrapping that up, it's a bit about what you can do, and understand the importance of brain health is something that, and if you would like to know more about that, then please feel free to talk to any of the MS specialists, MS Connect specialists, or the nurses, or any of the team at MSL about, if you'd like to understand a little bit more about the research and about neurological reserve and what that means for brain health, and also talking to it about your healthcare team and your neurologists. You know, feel free to say to them, tell me a little bit more about what this means, and how you're going to protect my brain health, because the most important person is the person with the brain. Also asking for, you know, promoting the idea of asking for an urgent referral to a neurologist, not only if MS is suspected, but if you've got a problem, and if you're having a relapse, then getting onto the GP and saying, hey, how can we get a referral to be seen quickly, and how can we make sure that we access MRI as quickly as possible. I know, as I said, in parts of Australia, that it's so different. Some people can get an MRI the next day, and other people it takes 6 months. So there's a huge discrepancy in people's access to services in Australia, and it's something that everyone who supports MS has an obligation, I think, to be able to promote equitability. And if you have a problem, then please let us know, because there might be a way that we can help. So reach out to MS Connect and see if there's any ways that they can help you with sometimes it's just negotiating the healthcare system can just be having someone on your side who knows how to speak the language. So or give you the language that you need to be able to say, I did it a lot in my previous role, just say this. Also staying in touch with your MS team if you don't receive a diagnosis straight away. Other things is talking to your team about your healthcare team about disease-modifying therapies and what are the options available. They're changing all the time, and that's such a confusing. It's an exciting space because it gives lots of different opportunities, but it's also confusing and difficult and to negotiate. And so the more we keep open conversations about that, the more we provide trusted and reliable information that's available, then the better off people are, and the more empowered people are to be able to make decisions about what's the right one for them based on their values and lifestyle considerations that they need. Embracing a brain healthy lifestyle is something that you can do, that we talked about, keeping physically active, keeping your weight under control, keeping your mind active, not smoking, watching how much alcohol you drink, and taking any other medications. And I guess thinking it's really easy with MS to just think about your MS and forget about all your other health needs. That's something that's really easy for all of us to do. If something's wrong, we forget about all the other stuff. But making sure that you there's lots of evidence to suggest that people who don't have other what's called comorbidities or other diseases well controlled, such as heart conditions and the like, that they'll have worse outcomes as well too. So it's important just to think about all aspects of your health and make sure they're all being monitored as well too. And again, I know MSL has a great library of webinars and advice on different aspects of keeping active, keeping your weight under control, diets. There's a lot of work ongoing at the moment about working with the Quit team to help people with MS stop smoking as well too. So there's a lot of work going on in that space. We talked about how you can help with monitoring your disease, keeping an MS diary and sharing it sharing that information with your healthcare team. So it's a hugely challenging thing, but it is something that I found that was very useful. And if you can't write it down, then take a photo. It'll remind you. That's something else that people can do as well too. And the more creative that we get in terms of the future in developing wearable devices and apps, the better off we'll be. I think that'll be a great way of being able to help in that space. Also, ensure that you feel well informed in the results of your assessments and MRI scans. That can be a huge challenge for people to be able to understand, what their MRI results are and what their clinical assessments were. If you ever have a question about that, feel free to ring MS Connect and ask to be put through to one of the nurses about the MRIs. The great thing of the future is that we're going to have a lot more accessible medical records for people themselves, and I just can't wait for that day, because it'll just mean that people are able to access results, and it's not like having to go through the results police to actually get the results and understand that and feel like you're in control of your information, because that's so important. And electronic medical records are a huge way forward. I know the Alfred Clinic have just introduced their portals for patients, so the whole of the Alfred Health, and so people can come in to access their own medical results. So I thought, how exciting is that people will really be able to have all that information, that's their information at hand. So I think that's a really important part of it as well too, so that you feel like you're the centre of you're the CEO. As Sally Shaw, our psychologist, often says, you're the CEO of your disease, and you've got it all handled, and of your brain health as it is. And so informed shared decision making is a part of that as well too. And there are lots of different resources. There's so many different resources, it's exhausting. But also, again, if you need any help negotiating those resources, please reach out to MS Connect, because they may be able to give you some advice and tips on how to negotiate different resources and what's going to be valuable for you to be able to sort of keep in touch with what's going on and what's happening. So the MS Brain Health Initiative is endorsed by lots of different professional societies and advocacy groups. This was updated in 2018, but there's even more now. And what excites me about that is that everybody globally is recognising that this is really important, and that this is something that we all need to focus on as an MS community. Every single one of us who's involved need to be focusing on making sure that we keep people's brains healthy, our own included. And so it's really good to see MS Australia has been really involved in that. MSRA, MS Nurses Australia, you can see support that as well too. And you see lots of presentations in the medical space about really recognising that this is an important initiative, and that this is about creating policy that will give you the opportunity to have a voice too. MS Australia has certainly used the MS Brain Health Initiative policy guide to provide to the government to help drive better advocacy and resources. So it's something that's been used in lots of different ways to be able to sort of make things, to be able to create services and to improve services and to improve access. And so that is our vision, is to create a better future for people with MS and their families. And it's an absolute privilege for me to be part of this vision, because that sort of just captured for me what I really wanted to do in my everyday work and continue to want to do as part of MSL. So if you have any questions, please feel free to contact MS Connect. And I've talked about some of these, there's the numbers, so I will whiz through those. The MS Connect team are amazing. They've all adapted to working from home now, and they all work really hard, and they will get back to you. if by chance they don't take your call, they will get back to you, but they've got a wealth of information and incredible depth in resources that they can tap into for you. They're just amazing team. The peer support team, this is Kim, Kat and Ange, and they are also a wrong way, Kat, Kim and Ange. They run an amazing amount of peer support groups as well too. They're really great if you're feeling isolated at the moment, to just touch base with a peer support group, and they can link you in to some of the groups that they're running now. There's been a really high demand for that lately, and the team there are just doing a stunning job in making sure that they can meet that demand. There's some other different resources available on MS MS website, and the Employment Support Services are also very active at the moment, and they are continuing to support people throughout COVID and throughout the challenge of COVID in employment. That's certainly something that people are feeling anxious about now, and what's happening, and lots of changes there. So reach out to the Employment Support Service. MSL is a registered NDIS provider as well too, so they have some great little services in there, and they've converted a lot of theirs to online platforms, doing some physiology online, telehealth activities as well too. So they've worked really hard to convert a lot of their services, and some in places of Wales have been able to get back to their gym and and open that up again as well too. And hopefully in the future, MSL will be able to provide some more support for people who are over 65 with MS, and we're really looking forward to being able to do that. And the team, the Amazing Education team, have also done lots of podcasts. If you're interested in listening to those, there's particularly around brain healthy lifestyles, including nutrition and sleep and mindfulness, and all sorts of amazing podcasts there. So thank you.
Thanks, Jodi. That's been fabulous. I would just encourage people to open up that control panel on the right-hand side of their screen, use the little orange box and find the little question heading and type in a question. You're very welcome to ask Jodi something. I was interested to find out if anyone is using a symptom tracker app. There are a few around, and we know some people are using them. So I'd love to find out if anyone's using one to track their symptoms, because that would be really useful. And Jodi also posed the question about access during COVID-19. If anyone's had any experiences that they would like to share, that would be interested to find out about that too. So please pop that in the question section, either now or follow up afterwards, whatever you're comfortable with. And I too would also just reinforce what Jodi was saying, that there's a lot more information about some of the specifics that Jodi has mentioned in today's webinar. If things like the decision making around medications, or how to keep active when actually you're feeling really fatigued, or how do I manage fatigue, any of those topics, there will be something on our website that you can either read, listen to, or watch to become more informed and to start that process of thinking about how am I going to make the changes to really feel that I'm in control of my brain health. And I'd also reinforce, as Jodi said, while you're typing in your questions, hopefully, I'll just reinforce that MS Connect is here for you. So please give them the number a call, the 1-800 number a call. And if you do need to leave a message, leave that message, because the team will call you back. Often they're overwhelmed with calls, which is a great thing, but they do commit to calling you back. And if you want that call back at a specific time, let them know that too. Their hours of operating now are 8 a.m. till 6 p.m. So if you need that call at your lunch break, or you need it before work or after work, they will make the time to do that call. So just checking, I don't think we've had any questions come in, which is amazing. Actually, I will share with you that Morena asked during the program about how we make sure the brain health document, or that research, is available for their GPs. Now, with the magic of technology, that document has actually been, that booklet has been sent out to everyone during the webinar today as an addition to your handouts. So everyone should have that in their inbox. And that would be certainly something that you could share with your GP, so that they have a better understanding of how to maintain brain health as well. So don't feel that you can't share it with them. And
and all those resources are actually available on the website as well too. There's slide decks, everything is freely available on msbrainhealth.org.au. I should have mentioned that, but any resources that you would like to have a look at, and if you want to know a little bit more about the Brain Health Initiative, it's all available on that website, msbrainhealth.org.au.
That's fantastic. So here's some little comments. Someone's using, actually, I don't think you've told me. Kerry, what is the name of the app that you're using? because some people are using apps to track their symptoms, which is terrific. Oh, it's called Emmeline. I haven't heard of that one. So that's one that we should follow up. But as Kerry points out, it's only as good as the information that you put into it. So that's a really good point. Yes. What else have we got? Oh, Kim's got one that reminds her. She can put in a daily reminder to put in her symptoms. So that's fantastic too, if it's got that feature. Andrew's got a question about the vulnerability to COVID for people with MS and how do DMTs affect that? Jodi, I'm going to suggest that people check into the COVID page of the MS website, because we had an update from a neurologist on that, unless you'd like to make a comment on that as well.
I guess that's such a thanks for that question, and it's such a learn as you go type of information. But what's really impressed me is how much the community, the MS community in the medical space, has really bandied together to find out that information and to share it really quickly. Of course, that's always going to take a while to filter through, but right from the get-go, the MS community started a Twitter group, which was just a really basic, but now they're having more and more information released, particularly in countries like Italy, where they've had a lot of COVID and how that's impacted on people with MS, the UK as well too. So that information's changing all the time, and so keeping up with it, because we're sort of only a few months into it now, has been certainly something that is a challenge, because new information is available all the time. But yeah, MS Australia does have an update on that in terms of the information. But last time I checked in, which was about a week ago, there was the overall evidence and message was that there doesn't seem to be a huge increased risk of people with MS getting COVID, or there didn't seem at the time, as I said, to be a massively increased risk of worsening outcomes, but it was, as usual in MS, dependent on level of disability, that did have some impact. So it's very early data, but there's a lot of work being done in that space to better understand risk, and a lot of information gathering as to be able to find out that information quickly and hopefully disseminate it as well too.
Thank you. Here's an interesting question. Elizabeth's wondering if you have a suggestion of a good length of time for a neuro appointment to be able to cover everything that's necessary.
Oh, I think that's really hard, Elizabeth. that is really, look, I think it so much depends on where you're at in the journey. And I do know that sometimes neurologist visits can go on for 45 minutes, and that's usually because there's lots of important things to say. I think half an hour is the standard in Australia, but I don't know whether that's even able to capture all the information. When there's a nurse in the clinic, it's sort of fortunate because you can get a bit of both. So you get a bit of time, you get half an hour from one, and my appointments were usually an hour, so that was good. But there are other ways to find out the information that you need as well too, that to be able to support you. But yeah, I think it's hard. The more you come prepared, the better off you'll get. The better you'll get out of that appointment as well too, and sort of make it as jotting down even just a few key points as you're sitting there waiting to say, actually, this is what I want to talk to today, because sometimes they need some focus as well too. Just to sort of say, hey, I want to talk about this today, and I want to talk about that. It really does help.
Yep. There is actually a guideline or a document, a template for people preparing for their neurologist appointment. That's available on the ms.org.au website. And if you have trouble finding that, ask MS Connect. Jodi, there's another question. How often is it recommended to have an MRI?
The general consensus is every year, unless something goes wrong. So that seems to, it's one thing that the Brain Health Initiative is actually working on at the moment, and that is creating consensus standards for care that can drive these sorts of care parameters, like how often you have MRIs, how often you see your neurologist. But the general rule of thumb, the best practice that's recognised at the moment is once a year, with, I said, if there's a change in symptoms or a change, then an MRI that's responsive to that as well too.
Cool. Sorry, I'm scanning through. Someone's made the comment about living in regional areas is really hard to see specialists.
I know. I know, and I hope that we can change that. Surely with the lessons that we've learned in COVID about how quickly we can get things done when we need to get them done will really start to shape how we can provide care, because rural services, as I said, that was something that really drove my desire to be part of this initiative, so that everyone had the same equity of access to the services that you need.
Yep, absolutely. There's a question in regard to, are there any, now I've lost it, sorry, any supplements that have been recommended around brain health?
The research in supplements is really difficult to do, and there's a lot of research going on. But the one thing about supplements and researching in diet is that humans aren't very good necessarily at telling the truth in those sorts of researches. But I think that it's a difficult area to be able to research, because often there's two things going on at once. You know, like people are doing supplements, but they're also doing another dietary change. So working out one from the other is a really difficult challenge, and therefore there's not a whole lot of research around which ones are going to be more benefit than other ones. But essentially, in terms of ones that do harm, which is another really important thing to understand, the more research is pointing to, if anything in excess has more potential to be harmful, which makes sense. And also there's a few that even just on MSRA website you'd find there's only a couple that actually have the potential to do harm rather than the potential to do good. So in response to that, I think that there's nothing that's really come out over and over again, except for vitamin D. Vitamin D supplementation is generally come out in research as something that can be useful. But the others are generally as much as do no harm as to do benefit as well too.
Jacqueline's got a good question, and I'm actually going to plug another webinar as well as what we'll answer now. But there is a whole webinar on cognitive reserve and making sure that you participate in activities to maintain your cognitive reserve. But Jackie's question is around what's more effective, brain training or learning a new language or a musical instrument? And I think I'll predict your answer. There's something about novel, isn't there? Not doing the same thing over and over, but doing things that are novel to maintain our cognitive reserve.
Yeah. Jackie, if you live with a family, I'm gonna protect them now and say maybe not a new instrument. My kids learn new instruments. I just want to say they could have gone with a new language. Look, I think that again, the researching that there is researching which one is going to be more. But there's research going on in that, but again, difficult to do that sort of level of research. But overall. If you keep your mind active in any way, it's going to give you a chug jug. That's for sure. You know, anything that you're doing to keep your mind active. I don't know whether there's any one thing that's better than another, and also something that's going to appeal to you. And as I talked a little bit about before, what's going to impact on the family that's going to be, or also something that you have enough engagement in to want you to keep inspired by it. And so that's really important too. What's going to float your boat that keeps you going and keeps you doing it? That's just as important as to which one.
For sure. Now I know we've gone over time, so if people need to leave, that's fine. There are a couple more questions and comments that I'll continue with, if that's okay with you, Jodi.
Yeah, sure.
A few people popping in the apps that they use, and another one is Flare Down. So that's another one to look up. People are finding these apps on Google Play, places like that. So that's great. And a few different experiences around their appointments during COVID-19, and telehealth having sometimes a positive experience. And then we've had some other people saying that was not so great. but it's good to read that there are some positive experiences, and it also came with being prepared for the appointment. So going into that telehealth appointment prepared with what you wanted to share makes that a whole lot more positive as well.
And stuff like getting the technology right first, I can imagine how much time do you sort of muck around with technology. It's also new for everybody using telehealth, really, but how awesome that we could, because imagine if we couldn't, what that would mean. And so I really think that the response for people to just really do whatever they can to be able to continue people's access to service was amazing. And you know, there were people who got the tech. I'm sure that there were clinicians who got the technology better and were able to use it better. Some people are more awkward on camera. I certainly feel much more awkward doing things on camera than seeing people. I love seeing people, so I would have wanted to reach through my camera all the time, I think. But I think that people, I think that we'll learn so much more about what's achievable through that, and learning quickly. People are just responding really quickly. Say, hey, if we ask people to do that, we're going to get a good understanding of that, and it's certainly something that we'll be able to learn really quickly.
That's great. And actually, Janet had an experience where she was able to put her questions forward ahead of time, which is fabulous. That's great.
That's great.
A question from Andrew in regard to benchmarking progression. So is there any way of measuring how an individual's progression sits compared to, I guess, the population, or what the MS clinician might expect?
That's a really good question, Andrew, because it's a real measuring progression is a real challenge. What I have found really useful is some clinics use a tool that sort of is able to plot people over time. The only measure that they have in clinic at the moment is sort of using a combination of MRI, an examination tool that they use called an NDIS, which has got lots of problems, but it's sort of recognised as sort of a global recognised tool to measure progression and function of the key areas that are affected by MS. And so it sort of gives a graphical representation in the clinic, and some clinicians use that, but I think apps are going to be able to give that back to the person, to be able to say, hey, I'm tracking myself over time and notice that I'm tracking at this trajectory, but there are ways of understanding what the average trajectory is. Although I say that with all the different treatments available now, what is average trajectory in MS is really difficult to predict, and so that's sort of where brilliant statisticians put their minds to work and use all that data to be able to they gather on these in this research to be able to predict those. But giving it back to the person is going to be the best place to hold that, and that they're going to be able to say, you know, that compared to this is what we would expect. And the ideal world that we all want to work towards is expect none. and so then any progression, and kind of in my mind I'm thinking, let people know if there's been any progression, because you want to predict, except for in primary progressive MS, you want to be able to predict as little as you possibly can, and it's always worth letting people know if you think that there's been some progression.
That's great. Some more comments and thanks and appreciation of the session, Jodi. So thank you so much for your time today, and thanks everyone for being online. We certainly look forward to more discussions with people, and if this was your first webinar, we really hope that you join into others, because they're always informative and there's always opportunity for discussion and questions and answers. So again, thank you for your time. Thanks everyone for being online, and we'll look forward to seeing you at another program. Stay online if you wouldn't mind. At the end of the webinar, there'll be a little survey, and we would really appreciate your feedback, because that helps us improve our programs. Thanks everyone. See you again.
Thanks everyone. Bye.